In this video, I'm gonna speak in English and hopefully I can have a chance to subtitles or translating in Korean in the bottom. But today, I am going to talk about the Piriformis syndrome. So Piriformis syndrome, I'm gonna go over what is the definition of the Piriformis syndromes and what's the signs and symptoms of this Piriformis syndrome, how to treat the symptoms or conditions with the massage skills by hands, and also I'm gonna go over CI, which is contraindication. What's the no, like you can't do this when you're doing the massage for this Piriformis syndromes, and what's going to be the best stretching home care for this condition. So hopefully everybody can grab some information from this video. Okay, so first of all, Piriformis syndrome. So definition of the Piriformis syndrome is simply there is a muscle called piriformis on the hip. So on the hip area, there's external rotators. We also say lateral rotators. I will just gonna put these pictures right in here, and then there is a muscle called piriformis, gemellus superior and gemellus inferior, and obturator internus and obturator externus, and also quadratus femoris muscles. So those 1, 2, 3, 4, 5, 6 muscle is also external rotator of the hips. And then if the external rotator hips are getting really tighter and shortened, there is a possibility that compressing the nerve called sciatic nerve. So once the sciatic nerve is compressed, it causes a lot of shooting or numbness, tingling feeling down towards back of the hamstring and then foot area. Pain is around the hip area and it goes a little bit down towards the back of the hamstring as well. So when this patient's walking to you, and then the most important things that you can ask for them is, have you seen a doctor? Have you been in a diagnosis as a sciatic nerve pain? Or have you been a diagnosis as a Piriformis syndromes? If then, have you get an injection, like cortisol injection? If they had a cortisol injection, you can't massage that specific area for 10 days. So you need to avoid that area to massaging it. Okay. So if you guys have, some of the person had an injection in that area, I try not to massage that specific muscle for 10 days. You can working on the other area, lower back, hamstring, knee joint area, or anterior tibialis muscle, which is in the shin bone area, but not directly onto the piriformis muscle. Other thing that I can think about is actually common causes. So what caused this Piriformis syndrome? There are tons of the reason why the people have this Piriformis syndrome. I think the most important things that first of all, you sit long period of time. Don't move, repetitive movement to overuse the muscles, and then the piriformis muscles are getting tighter and tighter, and we're never stretching that out. And then once the muscles are getting so tight and shortened, then it compressing the sciatic nerve, and then that causes the pain and discomfort. Also, inflammations. I think the most common symptom is for the pregnancy woman too. Like people who have a baby, the baby will compressing the nerve too. So usually people who are trimester 20 to 40 weeks of the baby pregnancy women, we try not to do any joint mobilization around the hip joint. So we try to avoid any joint mobilization or passive range of motion, anything like crazy hip movement. So we don't want to do that, right? People who joggings a lot but never stretching that out, maybe they might gonna have this Piriformis syndromes. People who drive a long period of time, like driving like 2-3 hours per day, they might gonna have it. It's because they're sitting in that car for a long period of time. And probably biking too. If you're biking a long period of time, you probably don't take a break, then this muscle can get super tight. Also, another reason is people who have a flat feet or hypertonated foot. So if they have a really, really hyperpronated foot, maybe there's possibility their piriformis muscles are really tight too. So like people who slip in their side, their hip external rotator, the hip muscles are getting tighter. And also some people who put the wallets in their glutes and then they sit on the chair for a long period of time, that could be the one reason too. Like the females don't really put the wallets in the back of their glutes on the pockets, but usually the male, they put wallets on the one side and then they sit long period of time. That's no. That can cause sciatic pain or the Piriformis syndrome. So if you do that, please do not from now on. So what structure is involved in Piriformis syndromes? So Piriformis syndrome, yes, your glute, SI joint, or iliac crust area, hamstring, knee joint, hip joint, ankle joint, anterior tibialis, everything around the knees and the leg area will be involved with it for sure. You can either check the Piriformis test, which is a figure 4 movement for the special test, and then see if this muscle is really tight or not. And then check either way, their external rotator is going to be really tight, but their internal rotator of the hip muscle is going to be really weak. So that's going to be another active rehabilitation exercise that we can focus on. For massage, what we can do as RMT. So first of all, we can work on some lower back, iliac crust area for massage. That's the first thing that I will do for massage. Second thing that I'm gonna do is Swedish massage, warm up the area, compression, but don't compress the sciatic nerve area. If the patients feel like the numbness and tinglings are going down to the legs, that means you are on the sciatic nerve compression. So always checking that pressure, always checking the numbness, tingling feelings when you're working on the glutes and the piriformis area. So making sure that you're not compressing the nerve. You can do PNF stretching, which is ching ching money stretching. You know that, like patients in the prone posture, and then you bend the knee and then you move the knees internally and externally rotated it. You put your fingers on the piriformis muscle and then make sure you open that up, the tight muscles, and you do some PNF stretching. So this is something that we can also do it. And then after that, we can try to do some trigger point release. So you hold that piriformis muscle, but make sure you're not holding the sciatic nerve, but you release that piriformis muscle slowly, and then try to do some passive range of motion after the trigger points and try to release that area. I think that's something that we can do it for all massage technique. After you work on that area, you can also think about working on the compensating muscle, which is the other side as well. It's because if the one side is getting tight and then sore, you're probably limping around, and then the other side muscle can be also tight. Contraindication. So first of all, as I think I kind of mentioned about the anti-inflammatory medication before the massage, try not to do any friction. So no deep tissue massage. So don't do any frictions in that area too. If a person had a cortisol injections less than 10 days, try not to working on that specific muscles area too. Joint play, no passive range of motion for trimester pregnancy woman, and avoid compressing the sciatic nerve if they have a lot of the numbness and tingling while we're doing the massage. Common things that we can think about it for home care, we can give them some heat, buttocks and the hip area for sure, and try to do some stretchings when you're sitting on the computer, sitting on the chair for a long period of time. We can give them some seated figure 4 stretchings. So I was kind of briefly go over how to do some Piriformis syndrome massage. If I do have chances, maybe I can try to make the videos and then giving you some idea, but just have to think about some of the technique and some of the CI contraindication, what we can do, what we can't do. The most important thing is kind of working on the SI joint balances as an active rehab, and as the exercises, we can also think about some internal rotators exercise with the TheraBand. That's something that we can also focus on, and change the biomechanics so they can start to changing their habits. Joggings, after bikings, after sitting long period of time and driving, they have to make the time to have some break in between of the movement and try not to overuse the muscle. So that's all about the Piriformis syndrome for today, and then hopefully this videos will help to any of the students or people who have these conditions. And I'll see you guys in the other video.